Welcome. Can I take medication while breastfeeding? For specific guidance on this topic, please do speak to your personal doctor. This episode is intended as a general guide and should not be considered medical advice. It is not usually necessary or recommended for a mother to stop breastfeeding due to her medication needs. However, this can be a confusing area for parents, as drug manufacturers are not required to provide clinical data on their safety for use in lactating mothers. The information insert will routinely state, "Do not take if you are breastfeeding," or "Please consult your GP or pharmacist before taking this drug if you are breastfeeding." This is not a statement of the danger of a drug, but relates to it not having been tested or licensed specifically for breastfeeding mothers. The GP or other prescribing doctor must therefore take responsibility themselves for that prescription. Questions that are important for consideration include the urgency and necessity of treatment for the mother, the age and maturity of the baby. The kidneys are not fully functional at birth, and premature babies are particularly vulnerable. The volume of breast milk ingested by the baby. A 6-week-old fully breastfed baby will be drinking a greater volume and therefore have more exposure than a 2-year-old who feeds once or twice a day. Known information on the drug with regards to lactation. Although trials are not done on breastfeeding mothers, there are known factors about drugs that can influence their safety in breast milk. These include, if this is a drug that is routinely given to children, it is usually considered safe for breastfeeding mothers. Drugs with a short half-life are preferred as there's less build-up. Drugs that are highly protein-bound are less free to enter the milk. Drugs which have a low plasma-to-milk ratio are safer, as it means that less drug transfers into the milk. Drugs that have been previously and commonly prescribed without negative impact to lactating mothers are preferred. There are specific resources like the Breastfeeding Network that give specific, reliable information regarding commonly prescribed medications. It can be useful to take the relevant fact sheet to your doctor when discussing a potential prescription's safety. It is important to recognise the advantages of breastfeeding and therefore the risks of unnecessary early weaning when considering a medication. A blanket recommendation to wean due to the mother's medical needs is not a neutral choice, and the harm must be balanced with any known side effects for the infant of this medication. So, to recap, it's generally not necessary for a mother to stop breastfeeding due to medical needs, but it is important for the prescribing doctor to take responsibility and consider factors such as urgency and necessity of treatment, age and maturity of the baby, and volume of breast milk ingested. Drug manufacturers do not typically provide clinical data on medication safety for lactating mothers, so known factors such as a short half-life, high protein binding, low plasma-to-milk ratio should be considered. Resources like the Breastfeeding Network can provide reliable information, and the advantages of breastfeeding should be weighed against any potential side effects of medication for the infant. It is important to consult with your personal doctor for specific guidance on this topic.